It is our pleasure to welcome you all here today at our 12th annual Expanding the Role of Promotores and Community Health Worker Conference. And our title today is Preparing for COVID Aftershocks. With us today is a distinguished guest that we are so excited to meet. And that is Dr. Murthy, who is our United States Surgeon General. So a round of applause to our Surgeon General. I'm going to get right into the questions because we have some questions from some of our community health workers that are dying to hear your thoughts, so here we go. As you heard, the theme of our today's conference is preparing for COVID aftershocks. We know that COVID-19 pandemic has disproportionately impacted the Latino community and the African American community, and you're speaking to hundreds of community health workers who have been door to door providing important public health support in our communities of color. How can the healthcare workforce be better prepared for COVID-19 aftershocks, whether it is the growing crisis of mental health among our young people or future pandemics?
Well, thank you so much, Venus, for having me here today. And I just want to welcome all of you to this conference, and thank you for giving me the chance to engage in conversation with you. Before we jump into some of the meat of the issues, I just want to say also personally why it's so meaningful for me to have a chance to be here with you, because long before I was a doctor and when I was just starting my journey in public health, I actually began working on building community health worker models in a small rural part of India, where I was very young at the time, and one of the great things about being young is that you don't know what you're not supposed to be able to do, and so you just try things. And so at the time, I was with a group of friends, two friends I'd grown up with, and my sister at the time, and we were brainstorming over Christmas break, during college, and talking about some of the health challenges we had been seeing in India, rural parts of India where our families had come from. And it was in that midnight conversation over the holidays that we made a decision that we wanted to do what we could to help build a community health worker model in rural parts of India that would ultimately help bring care to where people were. At the time, many people thought it was a somewhat perhaps outlandish effort, but what we learned over the years is just how much you can do for people's health when you have people who are committed, who have the trust of the community, and who know that they are the ones who can make the difference in the last mile in getting people the advice and the care that they need, and that can make all the difference in their health. And so I was really blessed by to work over the years with the community health workers that joined our organization, and they really opened my eyes up to just the power of what can happen when promotores actually get involved in their communities, and when we actually support them in the right way to make the difference we know they can make. And so you have all done that at scale, and especially during this last 2 years. I just want to say that we could not have gotten as far as we have gotten in the COVID response without you. We saw so clearly the limits of policy alone and money alone. Money and policy are important, but people are a really important part of the equation when it comes to addressing critical public health issues. And you have proven that time and time again. Because what people have, the money and policy don't, is they have trust. And when you have the trust of a local community, you can do a great deal. If you think about the profound challenges we have right now with misinformation spreading in the community, what people often want is to hear from someone they know and they trust, and so often that has been you. So I just first want to say thank you to you for the incredible sacrifices you've made, the hard work that you contributed during this COVID response. Our sort of successful efforts, I should say, in vaccinating the public and getting other resources to them is in no small part due to your hard work. And lastly, let me just say in terms of what comes ahead, and I know we're going to spend much of today talking about that. I think we've gotten through a lot of COVID. We've more tools now than ever before to address COVID, and particularly to save people's lives and keep them out of the hospital. But our work is clearly not done yet. And as I like the word aftershocks, that you use, because there will be these ongoing impacts of COVID-19 that we have to think about. There's the direct ongoing impact, which is that COVID has not disappeared, and there may be waves in the future of either old or new variants that come to our shores. I do think we'll be better prepared for them given our vaccines and treatments, but we will have to address them nevertheless. And then there are also the indirect aftershocks, if you will, the profound impact that the pandemic has had on our mental health, particularly the mental health of young people. And we are already seeing the impacts of that in schools. I just came back from actually visiting some schools and some young people rather in San Diego. I just did a school visit 2 days ago in Washington, D.C. And wherever I go, I try to spend time with young people in elementary, middle, and high school, and with their families and their educators. And what I hear time and time again is that the impact on mental health of our kids is being felt profoundly, with increased rates of depression and anxiety, with more fights breaking out in schools as kids try to navigate all the stresses of COVID and coming back to some semblance of normal. So we will have the mental health piece to deal with, we will have potentially future waves to deal with, and we also will have to deal with this ongoing challenge of misinformation, because we still, unfortunately, have a lot of that spreading around, which prevents people from accessing the helpful tools that we have, like vaccines.
That's true, that's true. Thank you so much. And as you know, burnout among healthcare workers is a growing problem. How do you feel about the prominence and sustainability of community health workers' workforce today?
Well, to be honest, I'm worried, Venus, about our health workers across the board, including community health workers, because I think as a society, number one, even before the pandemic, it's not like their jobs were easy, right? Like many of them, especially our community health workers, were underpaid. They were asked to work very long hours, and they were asked to do work that was very difficult, which was often get out there into the community and to, when you're in the community, when you're in somebody's home, when you're on the front lines in the most sort of a clear and present way, you can't just avoid problems, right? You can't sort of sit behind a desk and say, well, direct that to somebody else. Like, you're there in front of somebody in your community and they're telling you they have a problem, and it's up to you to try to figure it out. That's a taxing and challenging job. And so I think even before the pandemic, we had a gap in providing the adequate amount of support that we needed to the community health workers. And then COVID has exacerbated that because the demands on our community health workers have gone up, on health workers across the spectrum have gone up. And what we've seen are rising rates of burnout, anxiety, and depression among our health workers. One of my worries, Venus, is that I worry that the general public doesn't fully understand the extent to which this is happening and the implications for our overall health and well-being as a country, not just for COVID, right? But if we don't have our health workers cared for, supported, and well, that means all the other care that we deliver is not going to be as available. That means when somebody needs help with their diabetes medications, when they need to go see a doctor, for chest pain, and they're worried they may have a heart attack, and they need space in a hospital because they need to be admitted and to get treatment. All of those things will become harder when our nurses, our doctors, our community health workers, and others are burned out when they drop out of the profession. So this is one of the reasons that my office is actually working on an initiative on health worker burnout specifically, and we're going to have we'll have something that we're going to be announcing relatively soon on that. But we believe, and I believe, that our country needs a blueprint for addressing and prioritizing the well-being of our health workers. Because if our health workers are not well, then they're not able to help those in communities to the fullest extent, of their capacity. And also, I just think from a moral perspective, we should be seeking to support those who have supported us throughout this entire pandemic. Those on the front lines, and community health workers are squarely among those. Last thing is to say that if we want to do this, this can't just be a pot of funding that we make available, or one rule that we change, or regulation that we change. We have to look comprehensively at this, which is why my office is working on a broader blueprint. We need to, for example, make mental health services more available to our health workers, recognizing that the stresses and strains of their job are considerable. Number two, we've got to make sure that we are paying people an adequate living wage. We know that many health workers, and all of you know this better than anyone, but we have so many of our health workers who are who do not make enough to meet their needs and their families' needs, and so they're having to both deal with the challenges of work, but also worry economically about whether they're going to be able to make ends meet. And for the kind of the value that health workers are delivering in society, that should not be a worry for them. They should be able to know that, okay, if I do my job, serve my society, that I will have enough, to take care of my health and my family's health. So that's pay is important too. The third thing is flexibility. We know that health workers are human beings too. They have families, they have kids who get sick, they have older parents who need to be cared for from time to time. They will need the flexibility to be able to take time off and care for the people that they love. And what I worry about is there's so many health workers who feel guilty about doing that, who feel like they have to choose between the health of their communities and the health of their families. And that's a terrible choice that nobody should ever have to make. That means that we need to do a better job providing flexibility in our systems and support so people can take that time off. And finally, there's a cultural piece that we have to change here, which is that in the health professions and more broadly in our country, we look at mental health struggles as some source of weakness or as evidence that you're broken or you're not enough in some way. And some of our cultures, and I'll say the culture I grew up in particular, has that belief, very deeply instilled, that mental health concerns are just signs that you're weak and not something that you talk about. But we have to change that culture, right? Like when I trained in medicine, there was this almost unspoken rule that the people who were strong were the people who didn't need to sleep, who could go like multiple call nights, without getting tired and still do procedures and still admit patients, who never complained that there were too many patients on their roster, so to speak, but they could take care of however many people came in through the door. What I came to see over the years is that definition of strength, that's not real strength, right? Being able to just go 3 days without sleeping, or take care of more patients that are actually safe, that's not the goal that we should be aspiring to, and that's certainly not the model of strength that we should be teaching our younger, men and women who are coming into the health field. Right? We should be teaching people that the way we do better in providing health is to our communities is we support one another. We listen to people with empathy and compassion. We mobilize resources to get them the care they need, and we do this safely so that every health worker can sustainably serve their communities the way they want to, the way their communities want to. So we've got a lot of work to do as a country. I think there's a silver lining here, though, Eunice, which is that I do think there are more people who have realized that our health workers are struggling because of COVID-19. But we can't let this window of opportunity close. That's why our office is building an initiative around health worker well-being. And in fact, we would love to work with you as well and your organization to make sure that we use this as an opportunity to really turn the page and open a new chapter, in health worker well-being in America.
That's wonderful, because we definitely need that blueprint. Here in Texas, we have over 5,000 community health workers that are trained and certified, and we saw the amazing work during Hurricane Harvey here in Houston. They forgot even what they had to do at home to go out and help others, and it was incredible the number of people that we were able to take care of because of the love and the labor of love of these community health workers. So just before I go on to the next question, I'd like to give a round of applause to our Promotores and community health workers in the room. I'm so very proud of you. So, Dr. Murthy, can you speak on how public health systems can better utilize community health workers and promotores to eliminate health disparities, address population and maternal health, and achieve health equity, which is the key word now?
Absolutely. Well, one of the most important things that we have to do is educate the rest of the health community about the role that community health workers play and that they can play if they're utilized properly. I can't tell you how many times, like earlier in my career as a doctor, I was sitting in clinic with a patient, trying to work with them on taking their medications or in changing their diet or in starting on an exercise plan. And I kept thinking to myself, gosh, if there was just somebody who could actually follow up with them in their community, somebody who they knew and trusted, we would be so much better off than then coming to my office once every 3 months and us trying to work on medication schedules and lifestyle changes. It just didn't feel nearly as effective. And I would think back to the community health worker model that I built with some friends when I was younger, and about how those young women who were 16, 17, 18 years old became leaders in their communities, became the people that individuals looked to for help and for support when it came to their health. And the truth is that you're here, right? All of you are here, you do this work, and you do it remarkably well. But I don't think that many people in the health system right now, number one, recognize how important that role is or the value that you could bring. I think even though they are looking for somebody who can actually fill that role. I think the second thing is that we have to integrate community health workers into our care models, into primary care, into our hospital-based care models. One of the greatest risks to a patient's health that I saw again and again, when I practiced up in Boston, was in the transitions of care, right? When somebody leaves the hospital and goes back home, when they recover from a serious illness, the question is who catches them, if you will, and carries them throughout the care process, checks in on them to make sure that the things that the hospital may not have thought about, like do they have adequate food, at home? Do they have a safe way to get around their house, or even come to the doctor for a primary care appointment as a follow-up? Like who's checking on those things? Who knows the patient fundamentally? And this is where I believe community health workers are so important, which is why they have to be integrated though into the plan of care. And then the third and final thing is that we have to make sure, like all parts of the health system, to make it sustainable, that we are providing adequate support. That's financial support. It's also logistical support, right? So if we recognize that community health workers are a key part of the model, we integrate them into care, then there's a question that we just have to make sure that we are adequately supporting them. Because if we're not doing that financially, what happens is people can't sustain the work, which means ultimately they will have to drop out of the workforce or reduce their time in the workforce, and that hurts our ultimate goal, which is to provide high quality continuity of care to a patient. So look, COVID, I think in some ways has given us lots of opportunities. The question is, will we use it in the right way, and opportunities to think differently about our health system. But certainly I think one of the things that we've got to continue to push with healthcare system leaders, with medical and nursing organizations and others, is to look at a more comprehensive model of care delivery, and community health workers, I believe, have a central role to play.
Amen to that. Thank you. Dr. Murthy, what are some ways that Dia de la Mujer Latina, DML, and the National Association of Community Health Workers can be more engaged with the Surgeon General's General Office, planning and implementing activities that will improve some of the health and wellness issues that we just brought up?
Well, I'm so glad that you asked, and I'm aware of the incredible work that you have done, and it would be an honor to be able to work with you on some of these issues we've talked about today. I'll say two issues in particular I think would be right for us to collaborate on. One is around the well-being of health workers and burnout in the profession. As I mentioned, we have an initiative we're going to be launching soon in this area, but we would love to have your ideas, your voice, your engagement on this, because laying out a blueprint for health worker well-being is one thing. Implementing that blueprint is another thing, and so that's going to require ongoing work. And we want to pull together key stakeholders within our health worker community to make sure that they have a voice at the table and that they're driving this change forward. Because it's going to require holding community members accountable too, right? Policymakers, health systems, and others. The second area where I would certainly welcome us working together is on the ongoing fight against misinformation. This is something that I didn't fully appreciate when I was in medical school, learning to become a doctor. I thought that, perhaps naively, when I was in school, that if you study the right information, you get the right information, you share that with your patients in your community, then people will know what to do. What I hadn't fully appreciated was just how technology was fundamentally changing, like our ability to get accurate information to people, and in fact, often introducing disinformation, which is willfully or intentionally spread misinformation into the equation. And we're seeing that just so, at such a scale right now that we've never seen before. There's a recent study that was done a few months ago showed that almost 80% of people in America right now either believe common myths about the COVID-19 vaccine and about COVID in general, or think that those myths might be true. Think about that. That's almost 4 in 5 people. And usually, and I hear this from doctors and nurses all the time. They say they have to battle COVID in the hospital during the day, and then they come home at night and they're battling COVID misinformation, emailing their patients and family and friends and responding to messages where people have clearly come across misinformation and they're having to try to dispel those myths. You already do so much important work in that area, and trust is really the key ingredient here. It doesn't matter how many degrees you have or how many fancy institutions you've been through. People don't care about that when it comes to whether or not they believe your medical advice. They care about, do they trust you? That's what matters. And so the bonds of trust that you can build are extraordinarily valuable. In fact, I think they're the most important ingredient when it comes to battling this misinformation. So we will certainly, love to continue working with you on this regard, learning from what you are hearing and seeing so that we can better target our efforts. And I'll lastly just say there's a large coalition of organizations that want to address misinformation. I issued a Surgeon General's advisory in July on health misinformation, laying out concrete steps we can take as a community to address it, including steps technology companies to take to reduce the spread of misinformation on their platforms. But this is going to be an ongoing effort, and it matters not just for COVID, but for our other health areas, where we know that misinformation has been misleading people with chronic illness management and other aspects of health for many, many years.
And Dr. Murthy, now that you said we're talking about misinformation and dispelling myths, we have 2 incredible community health worker instructors, Robin Carell and Leslie Hargrove. I don't know if you can get up wherever you are, but they helped me in February of 2020, even before the pandemic even. They were instrumental in helping me put together the first community health worker training on COVID. On February 12th, it was sent to the state, and on February 24th, it was approved. And within 2 weeks, we had over 3,000 people, community health workers that took the training. And, we were ready, we were trained, we were rolling up our sleeves, but we were not invited. So this is something that I think is important for us, because we started with dispelling myths of COVID in February. We continued on looking at ways that we can build a workforce. So we developed a contact tracing training. We also looked at the mental health issues that were happening in our community, and we developed the Behavioral Health Community Navigator program. And then toward the end, we felt like the community health workers are so savvy. They know so much about our community. They are the best folks in this country to educate our community about clinical research. So we will have all this misinformation, and we developed the Clinical Trial Community Navigator program so we can integrate community health workers into research. And they are the ones that should be doing the recruiting and explaining what the process is with clinical research, because we definitely need more people of color into clinical research and clinical trials. So I'm looking forward to that blueprint. And I don't know if you have room for one more question? You have time for one more question?
Yeah.
Okay, here you go. Now that many places are moving away from COVID response, what is being done to ensure community health workers who are ready and trained to bolster vaccine confidence are involved in helping get vaccination rates back up against other diseases such as flu and HPV?
Gosh, that's a really good question. And as many of you know, because you are in communities, the rates of vaccinations for routine childhood illnesses has dipped during the pandemic. It recovered somewhat, but not fully. And so we have more work to do there. I think this is an area where I actually think bringing community health workers into that effort is going to be absolutely essential. I think about vaccinations as a wall of protection that we've built up over years through our childhood vaccination programs and others. But that wall needs to be continually replenished. We have to continue to vaccinate the next generation as younger people are coming through school. And if that, it gets put at risk, then we will start to see outbreaks of illnesses that we haven't had to deal with. We've already started to see that with measles to some extent in recent years, having outbreaks of measles because of pockets in our country where vaccination rates are actually low. So I think one of the things, so it would be great certainly to have community health workers engaged in that effort with us. I'm certainly happy, to work with you and thinking through who on the federal side could be good partners, whether that's our Health Resources and Services Administration or whether it's other aspects of HHS, particularly our CDC that works hard on improving vaccination rates. Ultimately, I know a lot of this will have to be local, right? And so we'll have to build the connections between community health workers and local departments of health, which help drive so much of the local vaccination efforts. I think the partnerships with school boards, with parent-teacher associations is also going to be absolutely essential because we know that we got to get parents to understand the importance of these issues, and schools also to understand how important it is to message on the importance of vaccines. So this is going to certainly require your engagement because, again, of that trust factor. And I'd like to just sort of end there as well, because on the trust piece, because I learned, one of the earliest things I learned when I was in medical school was that the most important thing you can do with the patient you're caring for is to build trust. And I didn't fully appreciate that in the very beginning, but in the beginning, when you start medical school, you're trying to memorize like all of the bones in the body and all of the molecular processes, that cause disease and all the names of the medications, etc. But I remember a wise teacher, I had a professor who pulled me aside one day and said, you will get all that stuff. The stuff that's most important for you to do is to recognize that the relationship that you are building, that itself has the power to heal. And when people feel seen, heard, and understood, when they feel there's somebody they can trust, someone who's looking out for them, that does so much to help in their healing process. And that to me describes so much of what you do. You build relationships. You help people feel seen and heard and understood. You contribute to healing in one of the most important ways and one of the most age-old ways that healing has happened, which is through the building of healthy relationships. And I hope that we use this moment in our country to recognize how important and essential that is in the healing process. I have worried that in recent decades we've become so focused on medical technology and on medications that we can develop. We've become a pill for every problem type of society, that we have lost sight of just how important those trusted relationships are in the process of healing and getting better. That is a currency that you bring in spades. And it's hard to put a price tag on that. You can't just hire a consulting firm to go into a community and get people to understand the truth about vaccines. People can't do what you do so easily. It requires time, effort, and energy to build that trust. So I just want to say just how important that is, how important you are for our country going forward, and how central you are in terms of our health strategy. Because without you, without people who are trusted locally, I don't think we can address the big health challenges that we're facing today. So just enormous gratitude for everything you have done and for the quiet sacrifices that you have made. I know you didn't do it to get your name in the papers or to get accolades. You've done this work with humility because you are dedicated to the health and well-being of your community. But I think it's up to the rest of us to recognize the role you've played, to make sure you're integrated into the health system, supported in the work that you're doing, because you are more important than ever before.
Thank you so much, Dr. Murthy. Oh, wow. What a privilege to have you with us. And today's a big day here in Texas because it's Community Health Worker Day, according to our governor and the proclamation that we received. So having you to celebrate Public Health Week and our conference has been an honor. So thank you, muchas gracias. And keep us in mind if you need anything translated culturally, linguistically appropriate, we're here, right? So thank you so much. Hasta pronto.
Okay. Hasta pronto. Thank you so much. I really appreciate it.